my name's Abby. I'm the registered dietitian here. Could you tell me a little bit about what you're experiencing and some things that you've got going on?
Well, I've been experiencing chest pain and edema just for the past few weeks.
Okay. Could you tell me a little bit about your past medical history, anything that you've had going on?
Yes, a few years ago I had a stroke and I was struggling to chew and swallow my food, but really that's really the only things that I've really had going on.
Okay, so today I'm going to perform a nutrition-focused physical exam, if that's all right with you. It's just going to help us see if you have any deficiencies or anything. Is that all right with you?
Yes, that's perfect.
Okay, first thing, I'm going to have you slip off your shoes and have you step up on the scale.
Okay.
Okay, 124, that's good. You can remain standing. Can you tell me what your usual body weight is?
Probably like 130 to 135.
130?
Yeah.
Okay. All right, next up I'm going to get your height. I'm going to have you put your back against the wall right here.
Okay.
Okay. 5'5", does that sound about right?
Yes.
Okay. All right, you can have a seat. Before we get started on the physical exam part of it, can you tell me a little bit about your daily intake and what your meals are looking like?
Yes, for breakfast I normally do like eggs and bacon or like a yogurt cup and some fruit.
Okay.
And then lunch is normally just kind of leftovers from dinner. Like past night we do a lot of pastas, chicken and vegetables, things like that.
Okay.
And then I do kind of sometimes have a snack between lunch and dinner most days.
Mm-hmm.
And normally it's like a soda and like a bag of chips or like maybe some fruit.
Okay.
And then dinner, we do, like I said, the pastas, chicken, pot roast, just mostly at home stuff.
Dinners.
Yes, we don't eat out as much for dinner.
Okay, so before we start the actual physical exam, I'm gonna get your waist circumference. Is that all right with you?
Yes.
Okay. I'm gonna wrap this around. All right. You can have a seat. Okay, so what I'm going to do is I'm going to start at the top of your head and I'm just going to make my way down and I'll explain everything as I go. Is that all right with you?
Yes,
okay.
Yes.
All right, so right here I'm just assessing if there's any muscle wasting or if you're at risk for any sort of malnutrition. Feels good. I'm going to move down to your neck to assess if there are any masses or goiters. I'm going to reach behind here. Good. Okay. I'm going to move down to your shoulders and your clavicles. Also assess any signs of muscle wasting, and I don't feel anything. That is good. I'm going to reach back here and check your scapula area. Okay, good. All right, can I see your arm, please? I'm going to assess the tricep area for any sort of muscle wasting as well. And then if you'll straighten that elbow out and press. Good. Okay. I'm going to move down to your knees. And this is also just assessing for any muscle wasting. And as I move down your leg here, I'm going to press on the back of your leg to assess any edema. And that feels good as well. Okay, next I'm going to assess for our micronutrient deficiencies, which appear in our hair, our eyes, our tongues, our lips. Is that all right with you?
Yes.
Okay, I'm going to take a look at your hair for any brittleness or color changes. Good. And then I'm going to take my pen light here. I'm going to look in your eyes. at your lips for any dryness or cracking. And then if you'll open your mouth for me and stick your tongue out, I'm just going to take a look at your tongue and look for any sort of redness or swelling. That is what we call glossitis. Okay, that looks great. Now, if I could see your hands, and I'm going to feel right here for any signs of muscle wasting. And then I'm going to press on your fingers and assess the nail beds, and they look great as well. All right. Next up, I'm just going to get some respiratory sounds, make sure that we're not struggling in that area. So I've got my stethoscope here, and I'm going to start at the chest, and then I'm going to listen to your stomach for some bowel sounds, okay? Okay, I'm going to move down to your stomach. All right, everything looks great. It sounds like your diet has gotten a lot better. Do you feel like your swallowing and chewing issues have improved?
Yes, they have. They have.
All right. All right, well, do you have any questions for me today?
I do not.
Okay, well, everything looks great. I'll pass this on to your doctor, and thank you for participating today.
Yes, thank you so much.